Hey y'all, my name is Zackery Peek, and this is my JAR Stage 5 Sci Talk about relapse and depression and rural methamphetamine use and the effects of the matrix method in a community setting. The authors of this study are Kit Sarawut, Kwan Shari, Sasathorn Wapana, and Chawin Sawan Chatchai. So what exactly is the matrix method of treatment? Well, the matrix method of treatment is an approach that is administered over a 16-week period. It combines behavioral therapy, education, and random drug screening like urinalysis and intensive group therapy sessions to help individuals manage their drug cravings, recognize their triggers, and maintain long-term recovery from drugs. And along with group therapy, individuals also receive one-on-one therapy where their therapist acts as both a teacher and a coach to help recognize their personal challenges to recovery. The matrix method of treatment is most often used with patients who are struggling with stimulant addiction, such as methamphetamine addiction or cocaine addiction. So, what did the researchers in this case study actually do? Well, the researchers examined whether the matrix model of treatment would actually reduce relapse and depression rates among people with methamphetamine use disorder living in this specific small rural town in Thailand. And they used self-reporting questionnaires to track patients' levels of depression and to track their relapse rates of meth. So, how did they actually study this? Well, they tracked the patient's levels of depression using standardized questionnaires administered every 3 months or upon the patient's completion of the matrix method of treatment. They tracked the patient's relapse by self-reported drug use and was verified through using random urinalysis throughout the intensive 16-week program. So, who did they actually use to participate in this study? Well, they used 962 adults with methamphetamine use disorder in a specific rural area in the country of Thailand. They didn't exactly give the ages of these participants, but they did specify the genders. And out of the 962 participants, 852 of them were male, but only 110 of them were female. So what the researchers found in this study is that the matrix method of treatment actually can reduce the chances of patients relapsing on methamphetamine as well as reduce the patient's levels of depression. But on the flip side of that, they also found that patients with higher levels of depression are typically at a greater risk of relapse versus those with lower levels of depression. So this case does have many strengths to it, but these are just two of the ones that I felt like were super important. I feel like one of the strengths of this case is that it was published in the year 2025, making it current and up to date. And mental health and addiction research is always evolving and changing over time, so this up-to-date research makes it more credible and reliable. And then another strength of the study is that it uses 962 participants. And I feel like this is a strength as it's a pretty large sample size, and that raises the power of the study and makes the statistical findings more reliable than that compared to a study that uses less participants. And while this study does have many strengths to it, it also does have a few weaknesses. And one weakness that I found on this study is that while it does use a pretty large number of participants, all 962 participants in this study are from one rural specific area in the country of Thailand, which limits the findings of the study to only people living in this specific area, in this specific population of people, and kind of rules out people living in larger cities or other countries altogether. Another weakness of the study is that it doesn't take into account the severity and the duration of the participants' meth use. And that is a huge factor because the more meth you use, the more likely you are to have higher levels of depression because we know that meth does things to the brain and it messes up your serotonin levels, therefore causing higher levels of depression. As well as they didn't identify co-occurring mental health disorders like anxiety, trauma, or PTSD, which those factors could also influence the results of this study. Thank y'all so much for listening. I hope you were able to learn a little bit about the matrix method of treatment and its effects on depression levels and relapse prevention of the drug methamphetamine.